This is Where We Live on Connecticut Public Radio. I'm Lucy Nalpathanchel. Healthcare disparities exist in many different populations in our state, but how well do Connecticut health systems meet the needs of transgender and non-binary residents? Today, Where We Live, we talk about the findings from the first statewide assessment of the LGBTQ plus community. It surveyed more than 3,000 residents about everything from basic needs to housing to healthcare. Coming up, we hear from two gender programs, one at Middlesex Health, the other at Yale New Haven Children's Hospital. And we hear from a longtime advocate about the need for more pediatric healthcare programs for youth who identify as transgender and non-binary. You can join us too, 888-720-9677. That's 888-720-WNPR. Share a comment on our Facebook page or find us on Twitter at Where We Live. Joining us first on Zoom is Diana Lombardi, Executive Director of Connecticut TransAdvocacy Coalition. Diana, welcome to the show.
Well, thank you for having me on.
Now, I mentioned this Connecticut TransAdvocacy Coalition, and it's part of the LGBTQ plus Health and Human Services Network created by the legislature through the State Commission on Women, Children, Seniors, Equity, and Opportunity. So, Diana, tell us more about the network and how this survey was one of the things that came out of the work.
Well, I believe this network was formed in 2019 by a legislative action. A bill created the network, and one of the charges that they had was to conduct a survey of the needs of the LGBT community in Connecticut. And with them, they named about 20 groups that were a part of the network.
And so when we think about this survey, my understanding is that the work that was to be done to put the survey out, that was happening before the pandemic, and then the pandemic happened. And so talk through with us, how many respondents the survey received, and were you happy with the results overall?
Yes, I was happy. And, we started before the survey of COVID, and we were planning to do more in-person interviews. And but when COVID came along, we had to change the direction of the survey from an in-person survey and online to just an online survey. And that made it a lot harder because for a lot of people, they don't have access to the internet. And I believe we had around 4,000 or 5,000 people take the survey.
And so that's a lot of people, but were you hoping for more, Diana?
Well, we always hope for more, but the survey was pretty good. We got a good representation of the population in Connecticut. There was a little bit of weakness in the survey from the quiet corners of the state. But other than that, we had a very good turnout. One of the things that were lacking was those who didn't have access to computers.
Right, because it was online. And before the pandemic, there was maybe more of an effort to think about how to get this survey in front of people beyond just in the mail, Diana?
Well, not so much in the mail, but attending places where the community comes together. Having somebody maybe at some of the bars or the community networks, LGBT community centers. Having people there sit down and walk people through the survey and help them take it. But because of the COVID, we were forced to just rely on computers and word of mouth.
The survey, I was surprised to read the first of its kind in the state, looking at the LGBTQ plus community. And so when we think about how to advocate for the community, it's important to know what the needs are. And so what were some of the findings that struck you?
Well, I think one of the major findings was that there was a lack of health care. People did not trust their doctors, and a lot of people could not afford to go to doctors. And also the health care that we need was not really covered. For example, for us who might have complications due to hormones or something, it was harder to get insurance coverage because they said it was related to our being trans or gay or lesbian. So there was things like that that created roadblocks for us. For many low income, they didn't have health insurance, so they relied on Husky and stuff like that. And so there was a wide discrepancy between socioeconomic levels.
When you talk about health insurance coverage and the work that you're doing with the Connecticut TransAdvocacy Coalition, you were a big part of pushing for broader health insurance coverage. So can you talk about what has changed, and are some residents unaware of these changes, Diana?
Well, what changed was the insurance commissioner issued a bulletin back around 2012 that basically said any coverage that non-trans people or non-LGBT people got, for us, we also had to be covered. For example, having a hysterectomy for trans men, it wasn't covered before, but now because of that bulletin, it is now covered. And so we fought a lot of times. The CHRO had a ruling a couple of years ago that insurance must cover all of us. And it has become less of a problem, but we still have holdouts that we have to fight for.
And you mentioned the CHRO, that's the Commission on Human Rights and Opportunities.
Yes, that's correct. They had a ruling back last year this time about health insurance have to be covered.
I wanted to focus on some of the findings related to healthcare. 16% of respondents reported being refused healthcare services because of their LGBTQ identity. Can you talk about that, Diana?
Well, a lot of times you never know that's why you're being refused. I've had good luck with doctors and healthcare experiences, but I know some that have not. You really have to fight for it. A lot of times the doctor doesn't tell you why they don't want to treat you. I had one doctor that never looked at me during my appointment when I came in to see the specialist. He sat there looking at his computer all day. I don't know if that was because I was trans or that's how he normally does it. So it's really hard to pin down why we're getting rejected. When somebody says they don't want a new patient, we really don't know why it is. So that's one of the things that we have as a trans people. We don't know why we're not being treated.
And that can inform recommendations that come out of this survey, and the idea of helping people find LGBTQ friendly providers and staff who are trained on the needs of this community, Diana.
Yes, there's the community centers down in Norwalk and New Haven, and here in Hartford, for Hartford Gay and Lesbian Health Collectivists, they have referral lists. So if you want a trans-friendly doctor, you contact them, and they usually have some doctors. But it shouldn't have to be that way. You shouldn't have to go to a place where they have a list of friendly doctors. It should be just routine. Just go to the doctor, and not have any problems.
You're hearing with us on Zoom Diana Lombardi, Executive Director of the Connecticut TransAdvocacy Coalition, as we talk about the first of its kind survey of the LGBTQ plus community in our state, assessment of their needs from housing to healthcare and other topics. You can join us, 888-720-9677, or find us on Facebook and Twitter at Where We Live. We talked about insurance coverage, Diana, but also in our state, there is a gender change on birth certificates that became a lot easier, no longer for requiring surgery. Explain why that is important.
Well, for many trans people, they cannot afford surgery, but many of them do not want surgery. And so because the old forms required you to have surgery, which is a very invasive procedure, it's not simply you go in and have a hangnail replaced. It's a 4 or 5 hour surgery, so it's very intensive. And for a lot of people, they can't have surgery like that. They might have a secondary care, like diabetes or a heart condition or kidneys, and so they can't go to have surgery. And without being able to change your documentation by not having surgery, you were forcing all these people to live with documents that did not say their true identity. So by allowing people to change with your gender markers on your birth certificate, driver's license, passports, and stuff like that, it opened a lot of opportunities for trans people. It didn't have that much discrimination because you wouldn't go to a job and it would be listed male when you identify as female. So it gave a whole new area that we could get jobs without having to worry about our documentation.
When we talk about transgender and non-binary residents, Diana, how many people are we talking about here in our state? Do we have any idea?
Well, that was one of the questions that kept on coming up when we were trying to pass the non-discrimination bill was how many people are actually trans in Connecticut? And we never knew. And this survey helped pin us down on the numbers. Somewhere around 0.5 to 1% of the population is trans. But it's very hard to count because a lot of people don't want to be counted. They fear discrimination. So it's just an estimate.
And so this report that we mentioned, the survey, there are several recommendations. And so what do you want to see happen now that this has been reported out, Diana? How communities, even organizations within our state can respond to the population?
Well, I think we need better education. If you look at the survey, there's a lot of LGBT people that don't know what the laws are today. They don't know what a hate crime is. What's the difference between protected speech and non-protected speech for hate crimes? We have to educate people more. I think we have most of the laws, but most people don't realize we do. And so we have to educate not only non-trans people, but also the trans community, what's available to them and how to fight for their rights.
You are also part of the Governor's Council on Hate Crimes. Can you talk about that work, Diana?
Well, the council just started, but we're evaluating right now different laws in around the nation, what works and what doesn't work. We're trying to identify how we can improve the laws here to limit hate crimes. Maybe one of the answers is better education, an advertisement campaign about what a hate crime is. So we're looking for different ways to advise the governor on how to proceed to stop hate crimes.
Before I let you go, Diana, you had mentioned earlier an experience that you had in a doctor's office, and I'm wondering if you can talk about, despite the advances in recent years in our state, when we think about trans and non-binary healthcare, specifically expansion in insurance coverage or birth certificate changes, some of your personal experiences about, some of the advances in the state, but where more work needs to be done.
Well, I've been pretty lucky. I had a good set of healthcare providers. I really haven't had a problem. That one was a specialist, and I had a medical problem that required me to go in and have some tests run to see what was causing the problem. But like I said, I don't know if this is how he always does and just enters the data on his laptop and not looks at his patient. So I don't really know if it was discrimination. And that's one of the problems. But I think the other thing is that we have to make people aware of what the law is. To me, I think is the biggest thing that we see is people do not realize we have laws out there to protect us.
One of the recommendations in the report, again, there are several, but the recruiting LGBTQ plus providers to work in Connecticut, especially in the healthcare and mental health sectors. Tell us about some of that work that needs to be done, Diana.
Well, I think in med school, they need to also include more LGBT healthcare. I volunteered for one of the local training hospitals, medical schools. And, they have about a half a day training on LGBT people. And most of that is just talking by people like me who get up on the stage and talk about what they found and their healthcare problems and all that. I think they need to have a whole semester of working with LGBT clients.
Wow, half a day training that you mentioned. That's something.
Yes.
Well, Diana
but it's
Lombardi,
actually more than some states. Some schools don't have anything.
Well, Diana Lombardi, thank you for coming on to talk about, again, this survey of the LGBTQ plus community. Diana's executive director of the Connecticut TransAdvocacy Coalition. A lot of good data in this report. Are you hoping to do this on an annual basis, or what are the plans for the future?
Well, I don't know. It depends on the legislature. My guess would be every 3 or 4 years.
Well, Diana, thank you for your time today. We appreciate it.
Thank you for having me.
This is Where We Live on Connecticut Public Radio. Coming up, we hear from the Middlesex Health Center for Gender Medicine and Wellness about how community health centers are better positioned than other larger hospital systems to provide full spectrum care for trans and non-binary residents. And we hear about the urgent need to improve pediatric care for trans youth. Stay with us. This is Where We Live on Connecticut Public Radio. I'm Lucy Nalpathanchel. We just learned about the first statewide assessment of Connecticut's LGBTQ plus community. Among the feedback from more than the 3,000 residents was this, quote, that the U.S. healthcare system does not meet the needs of transgender and non-binary communities. Respondents in Connecticut's survey mentioned, quote, discrimination, malpractice, or mistreatment, and not being able to afford gender-related surgeries because of insurance. Now, Middlesex Health in Middletown launched a center focused solely on gender medicine that has since expanded into every medical department. Joining us now on Zoom is Katy Tierney, Medical Director of Middlesex Health Center for Gender Medicine and Wellness. Katy, welcome to the show.
Thank you so much for having me.
And this note, Middlesex Health is an underwriter on Connecticut Public Radio. So, Katy, tell us more about this Center for Gender Medicine and Wellness and what it means and how you got there to be a full spectrum care location for trans and non-binary residents.
Well, it started, I joined Middlesex Health about 8 years ago and doing trans care myself, really discovered a community hospital that was ready and willing and excited about providing true, competent, and confident transgender-related care. I try not to be a silo, and I work in endocrinology, so I mostly do hormone therapy, but there's so many other facets to being a trans person and accessing healthcare that, my philosophy really is that if you're a trans or non-binary person coming into a health system, you should be able to access that health system at any level, whether that's the emergency room or mental health or surgery or endocrinology or primary care, dermatology, pelvic physical therapy, voice therapy, whatever it is that you need, that you should be able to come in and not need something special. We should be already ready to take care of you the best way that we can. There's certainly, as Diana mentioned, a dearth of programs that train for trans health and trans-related health, and we're early in the process, just historically figuring out what's right for people. I was very lucky to be working in a health system that had people in every department that raised their hand and said, I want to, or I am competent in this kind of care, and we want to move this forward.
That's interesting. So before the center was created, if somebody identified as transgender or non-binary, they might have been referred to a specialist versus thinking about the primary care, and that you might have a healthcare provider or special provider or professional within a hospital system that understands the transgender community versus siloing them, as you mentioned, to a specialist.
Right. I mean, certainly, in hormone therapy, it helps to have somebody who's very comfortable with that algorithm and with that kind of treatment. But if you're, if you're a trans person, I always tell my patients, you're still a person, and that in that sense, you may need healthcare in all kinds of different areas. And so sometimes being trans or taking hormone therapy might affect that care, but sometimes it won't. And what you need is a competent provider that can treat you the right way, in spite of or because of your trans identity or any kind of transition that you're going through. And ultimately, if you take a step back from that, really the goal is just to be able to take care of everyone and do it in a professional and kind manner, because we want everyone to be able to access the health system and get the healthcare that they need, especially in this time when we're discovering sort of the holes in healthcare and where we're not doing as well as we could. We want to shore those up as best we can. And it certainly takes time, and institutional cultures are hard to change across the system, whether it's government or healthcare or schools or whatever it is. But we, at least in my program at Middlesex, really want to make sure that we're adding each piece that we need, that the community is looking for, so that we can provide full spectrum care.
And how many patients does the center treat today?
So best estimate, and it's hard sometimes to count people, as Diana mentioned, it's, if people don't self-identify, we don't always know, and computers are what they are, but our best guess is somewhere between 1,200 and 1,500 trans people access our health system.
And what do waiting lists look like, especially when we think about your center versus some of the bigger hospital systems, when someone's looking for care and is looking for a provider that understands where they're coming from?
So it, again, depends on what kind of care you're looking for. In surgical practices, patients turn over relatively quickly, so that's, easier to get in. In my endocrine practice, our wait lists are usually between 3 and 6 months, depending on where we're at in the year, just because there is such a demand for that kind of care. One of the places I think in our state where we see the most difficult wait lists are with our adolescents, because there's definitely a time component to that for our adolescents who are going through or about to go through puberty. So some of the larger health systems do have backlogs, mostly because there is such a demand and we have so few programs. So recently we did add an adolescent provider so that we can hopefully decrease those wait times for us and for also those other bigger systems. So our current wait time for adolescents is less than a month, though we'll see how the demand goes because it is a new program.
Talk more about the need to respond to children, especially those with gender dysphoria, and how they're referred to a place like the Center for Gender Medicine and Wellness.
So most of the time our referrals come from mental health providers, because that's usually where families present, or if they present in schools, that's sort of how they get connected with mental health, and then they get sent to us. Once we're, our British chute is the nurse practitioner who sees our adolescent patients. And I think her philosophy, or our philosophy as a program, is really that the more information that families have, the better. So deciding when and how to start either the puberty blockers or hormones is really a decision that really needs to be made collaboratively between the providers, the mental health providers, the endocrine provider, and also the family. And so making sure that that kids are getting in at least to have those conversations. Sometimes that's enough just to give the lay of the land and see what will be happening in the next couple of years. Helps the family understand, helps the kids have a plan, makes the kids feel like they're being listened to and that their identity is important to their healthcare provider and their family. And then, of course, getting them started on the appropriate medical treatment at the right time can be life-saving for so many of these adolescents.
You're hearing Katy Tierney here on Where We Live, Medical Director of Middlesex Health Center for Gender, Medicine, and Wellness, as we talk about the needs to improve healthcare for the LGBTQ plus community. You can join us, 888-720-9677, or find us on Facebook and Twitter at Where We Live. I wanted to bring into the conversation Tony Ferraiolo, Director of the Youth and Families Program at Healthcare Advocates International. Tony's been a longtime advocate for transgender youth. Tony, welcome to the show.
Thanks for having me, Lucy. Nice to be here.
And nice to hear from you again. You do, as Katy mentioned, this is life-saving work. Let's talk about that. And when she mentioned the need to help young people within a certain amount of time, why that's important.
It's so important that when a kid says I'm trans or I'm non-binary, they're ready. It takes a lot for them just to get to the point to say this is who I am. And if we can't provide them with the medical needs that they need, if they do need medical intervention, it really has a big impact on their emotional health. And this, that I sit in the hospitals and talk to kids right after they try to kill themselves. And a lot of times it's all about their bodies and dysphoria. And if we can't get them in to see providers that will help them with that, it's not going to be a good journey for them, right? Also, we have to think about just primary care. Healthcare Advocates International, we provide primary care for LGBTQ plus people 13 years and over. It's uncommon to be able to just walk into a primary care facility and be treated with dignity and respect, and people using your right name and pronoun. So it's a really cool organization to be able to really serve this population, but we can't be the only ones. Right.
We've used some terms that maybe some of our listeners are unfamiliar with. So I had mentioned gender dysphoria to Katy. Let's talk about that, Tony, and also that statistic about suicide, which is very troubling.
Yeah. So, gender dysphoria, body dysphoria is the anxiety and distress that comes along from the mismatch between our bodies and our minds. And as a trans guy myself, I struggled with body dysphoria for many, many years, but was able to access what I needed because I had the money to do it. It wasn't covered by any insurance back in the day. I transitioned in 2005. And as Diana mentioned, there's a lot of things that have changed. One thing that hasn't changed is to be able to just say to a patient, hey, you need a specialist, go here, and they're going to take care of you. We have to make sure that specialist, we used to say trans friendly, but we need to say, are they trans educated? It's two different things, right? Friendly is I'll see you, educated is I'm going to treat you with the dignity and respect that you deserve. Remembering that we're all at our most vulnerable when we're sick, right?
That's an important point. And so the work that you're doing for Healthcare Advocates International, educating providers about the needs of the trans community. So talk more about that.
So we're working with families to help them advocate for themselves, right? So, one of the biggest things that we've been doing is, and I couldn't believe how many families have reached out to the program saying, hey, listen, I brought my kid to their pediatrician. Their pediatrician doesn't want to see them now because they're trans. They don't understand this. And my question in my mind has always been, a sore throat is a sore throat, right? We're not asking you to, the pediatricians, to provide hormones or blockers. We're asking pediatricians to take care of a young human the way you would any other patient that walks through your door, And one of the ways that we're trying to help young people through this body dysphoria, as we were talking about before, is providing binders, chest binders, which are garments that they wear to flatten their chest. And we've been sending free binders out since January all over the world, and we shipped about 100 out. This is life-saving, right? So it helps us help these children from, okay, I can't be in my body, to, okay, I feel comfortable now enough. If they need medical intervention like top surgery, then they're able to stay alive long enough and maybe a little less emotional distress until they can access that. So there's a lot of things that we can do at Healthcare Advocates, of course, but everywhere to really support these children. Lucy, I've said this for years. If we can give these children hope for a better life, they won't want to take their life. Almost half of trans and non-binary kids that are surveyed attempt suicide, Lucy. Not think about suicide, but attempt it. And I know that is fact because I can't tell you how heartbreaking it is to sit in front of a 12-year-old. I just did this a couple of months ago, who tried to kill himself 3 times since January. And it was all because of his body dysphoria. So what did Healthcare Advocates Family and Youth Program do? We said, okay, do you need a binder? And he was like, what? I was like, yeah, do you need a binder? I can have a binder. We gave him a couple of binders. It just shifted him so much. And he got out of the hospital and he contacted us a couple of weeks ago and he said, I'm planning my future. I'm sorry, I get choked up. We saved him because we gave him what he needed until he can access the medical care that he deserves.
You're hearing Tony Ferraiolo again here on Where We Live, Director of the Youth and Families Program at Healthcare Advocates International. Katy Tierney at Middlesex Health, can you respond to what Tony shared, and even on the topic of providing free binders and why that's so pivotal?
I think what it comes down to is when you recognize the identity of someone and you take away your own personal expectations for other people and allow people to flourish as the people they are, and by doing something as simple as I see you and I'm going to support you in this journey with something as simple as a binder or a pronoun or a correct name, I think you can take away the perception that they are being marginalized or that they're being disrespected. And I don't think we give enough credence to something like this because, at the end of the day, all of us want to be seen for who we are and who we truly want to be. And that idea of giving somebody their future or showing them a way to get there is so critical. Being an adolescent is so hard these days. I feel like I don't know how they do it sometimes. And being a trans adolescent, not knowing what that future looks like and not knowing that you have that kind of support or not having that kind of education from your trusted people, right? Your healthcare providers, your teachers, then of course you can't see the future. And of course it doesn't feel like there is one. So people like Tony and hopefully our program, we're giving people that idea that they can be who they are and explore that and still be valid.
Again, you can join us 888-720-9677 or find us on Facebook and Twitter at Where We Live. Madison's calling in. Madison, what's your question?
Oh, hi, this is Madison. Hi, Katy. This is Madison from Hartford. I've been a patient for 8 years, and I get just wonderful service down in Middlesex and with Katy Tierney. My question is that when do you feel, or do you have any idea when Middlesex will be able to offer transgender women vaginoplasty surgery?
As I said before, we're always trying to add those little pieces. We are working as hard as we can to make sure that we can provide everything that everyone would need.
Again, you can join us if you have a question about how to improve or help improve healthcare for the LGBTQ plus community. The number 888-720-9677 or find us on Facebook and Twitter at Where We Live. Tony, I wanted to get back to you and some of the conversations that you're having with healthcare providers, the trainings that you do with Healthcare Advocates International, but also just some of the conversations that you're having with families. You shared that anecdote about the one young person. And again, what Katy shared with us, building on seeing these children as human, right? As people
Absolutely.
that need help, and how to get that kind of conversation started, as well as the work you're doing to help families.
Yeah, it started Friday. We did a workshop Friday night called From Fear to Acceptance, and it was for parents and caregivers of trans and non-binary young humans. We had about 60 people participate. They were from all over the country. It was supposed to last an hour. It lasted 2.5 hours because there were so many people in such distress. And if we can give parents the tools to honor their children and meet them where they are, right? And a lot of people are like, how do you save these kids, Tony? It's not me. It's not me. And like Katy, and I like what Katy said, what we do is we listen to what they need. We believe them. Right. And we provide it to them. And if healthcare advocates can't provide it to them, then we send them someplace that can. But parents sometimes get so wrapped in the fear of, oh, my God, what is my kid's life going to be like? Because they hear listen, we're in the middle of Trans Awareness Week. Saturday is Trans Day of Remembrance. And we know what that day is about. Right. So the parents see that and they're very concerned about their kids. If we can get the parents on board to protect their kids and be their advocate at medical providers and make sure that medical providers are treating their kids with dignity and respect. I mean, we get calls saying, should I tell my dentist that my kid is trans? And I'm like, well, why? I mean, my suggestion is no, you do not need to tell your dentist that your kid is trans, because we know that once we come out as trans at a health provider, no matter who they are, what specialty it is, the likelihood of us being treated different is very, very high. So that's why we need to, we have a vetted list also at Healthcare Advocates that we will not send you anywhere where we know they're not culturally competent. Even blood draws, right? We have to be able to send people to places where if our name and pronoun doesn't match our legal name and pronoun, that they're going to have a space where they know that they can still honor us and use the right name and pronoun.
So that list that you mentioned, what does it look like from the
It's
work
not
that
that
you're
big.
doing?
It's not that long. It's not that long. Listen, like Katy Tierney's program is a program that we refer people to. But for primary care, there really isn't a lot of places where we know of. I mean, there might be some people that are going to primary. I know I go to a primary care specialist in Hamden, Vanessa Pomerico. She's awesome. She's been doing trans health forever, but not everybody lives near Hamden, Connecticut, right? We need to have providers all over the state. You should be able to just call up a provider and walk in and be cared for like everybody else.
Katy, Tierney, what happens when we hear stories when families are struggling and young people who come out and tell their family that they're trans or non-binary, and they're on their family's insurance plan, but not all some families are struggling. And so what happens if that child is turned out of the home and doesn't have anywhere to go? How do they get connected to that care?
That care then becomes all encompassing, right? We need to make sure that they are, getting housing. We need to make sure that they're getting food. We need to make sure that they're being taken care of a human being long before they're getting trans affirmative hormone therapy. But, sometimes the place that I see the most, the joy that I get really is when we're able to help people take care of this one part so that they can become their full selves. So that means that they are more confident. They can find work and not be afraid that they're going to be targeted, or they're able to come out to their families and really help their families be educated so that they can remain part of that family structure. And when they can't remain part of that family structure, then we then we figure out how to make that better. But one of the things in the LGBTQ community has always been chosen family, and so many in our community are taking care of each other and making sure that we have those resources, from Diana to Tony to more formalized programs.
Mm. Tony, you mentioned the high rate of suicide attempts among transgender youth. I've seen that same statistic from the American Academy of Pediatrics. And so for people that are listening who may be struggling, what resources would you like to refer them to?
Yeah, I mean, and reach out to everyone that's on this show. I mean, I know that you can reach out to me, go to your community. Like Katy said, it's so important that we create a family. Look around you. There are people who will be kind to you. Don't sit in silence, and don't sit in isolation. The Healthcare Advocates Youth and Family Program will refer you out to whoever. Part of the program is, I'm a certified life coach, and Healthcare Advocates is allowing me to coach young trans people, non-binary LGBTQ youth for free. So if they have financial reasons why they can't pay for therapy or for a life coach, they can come to me and I will coach them for free. It's a way to get them through some really hard times, and to start saying to them, hey, have you heard of, PFLAG? Have you heard of, this group here? New Haven Pride Center has a youth group. We have a youth group. So to try to get these children into a group where they can kind of talk about their struggles with people that are going through the same thing is super, super important. And it has saved lives for years. Mm-hmm. Support groups are really, really important.
And Katy, oftentimes on the show, we refer people to 211, but when I was reading this LGBTQ plus survey, the statewide assessment, some respondents said when they call 211, it hasn't been helpful. So is there a number or hotline that people should be referred to that as Tony mentioned, are LGBTQ educated?
So, certainly it depends on the acuity of the problem, right? If somebody is actively suicidal, then we need a trans suicide hotline, which they can call, of course, or their mental health provider. For less acute issues, I think, getting connected with, we have a navigator who's a social worker here at Middlesex who can help connect people to the services that they need. Places like the Hartford Gay and Lesbian Health Collective certainly has resources as well. Tony's program, really just reaching out to any kind of program in the state that does trans care will be able to help navigate that for the patient.
And we will let our listeners know they can go to our website, ctpublic.org/where-we-live, where we have links to all of our guests and their organizations today on the show. You've been hearing Katy Tierney, again, Medical Director of Middlesex Health Center for Gender Medicine and Wellness. Also with us, Tony Ferraiolo, Director of the Youth and Families Program at Healthcare Advocates International. We're going to continue talking after the break. You can join us too. Find us on Facebook and Twitter at Where We Live. This is Where We Live on Connecticut Public Radio. I'm Lucy Nalpathanchel. It's Transgender Awareness Week, and its national survey LGBTQ organization GLAAD says reports of discrimination have increased this year. And in 2021, state and federal lawmakers introduced more than 100 bills to restrict the rights of trans women, people, and youth. Today, we're focused on health care for transgender and non-binary Connecticut residents, including young people. Joining us now on Zoom is Dr. Christy Olezeski, director and co-founder of the Yale Pediatric Gender Program. That's within Yale New Haven Children's Hospital. She's also associate professor of psychiatry at Yale School of Medicine. Dr. Olezeski, welcome to the show.
Hi, good morning. Thank you so much for having me today.
We've been talking about some issues in providing focused care, including longer waits. And so tell us about the Yale Pediatric Gender Program and how you're working to tackle this.
Yeah, sure. So I will say that as mentioned in previous, talks with Diana and Tony and Katy, that we are really trying to work together with other community providers to be able to provide really effective healthcare for youth. And we're finding similar things, that folks are not educated on, trans healthcare. I could tell you that when we first started our program in 2015, I had been speaking with Tony, and he said that there was going to be a number of folks who would be needing care. And I said, well, we're in such a small state, really, how high could the need be? And quickly we grew to have a 2-year wait list. And so we've been continuously adding on our clinics to be, serving folks all throughout the state. Currently we are seeing individuals across all 8 counties in Connecticut and 5 outside states. We've served over 300 youth so far, and I could tell you that our wait list is pretty lengthy. It's about 15 months right now. And so we are, trying to educate folks in being able to provide healthcare in other settings as well, and collaborating with other folks in different settings to be able to make sure that youth are being able to get the care that they need. As Tony and Katy had said previously, this is life-saving treatment, and it can be really upsetting for folks to be on a wait list for that long.
When you talk about health care, talk about mental health care, especially when we're talking about children.
Yeah, so I think that, when we started our program, it was really important to us to provide a holistic approach. So incorporated in our clinic is, an endocrinologist, a mental health professional. There's a legal advocate for any legal issues that may come up, as well as now we've embedded a chaplain in our program, as well as other outside, ancillary providers. And, the reason why we do this is because we know, as, Tony and Katy had mentioned, that there's such a high percentage of folks who are experiencing other co-occurring issues, depression, anxiety, et cetera. And so I could tell you with our population, we've had folks, as Tony had mentioned, the suicide attempt rate is really high. We've had about 26% of our folks have a previous suicide attempt. And about 60% have had previous or current suicidal ideation. So this is really important for us to be able to not only meet the patient's needs when they come into clinic, so to assess for these things, to be able to give them resources, to connect them to groups. As Tony mentioned, finding groups and community connectedness is really important. So we've, increased our groups. We have a parent group and a youth group that meet twice a month. And we're trying to, have good connections with other community providers to provide mental health care. But as has been previously mentioned, folks are not always provided or are not as educated in trans healthcare as we'd like. And so that's something that's really important to be able to find.
That sounds like a crisis point, right? If you know that people are struggling and there's high rates of suicide attempts, to have more providers that understand the needs of this population. Dr. Olezeski?
Yeah, it is something that is really important. And I think that's something that we've been trying to do at Yale. I think, as Diana had mentioned previously, there's a half-day training. Oftentimes, I think national average is like 5 hours of training in medical school for all LGBTQ healthcare, which is abysmal. And so we have been trying to reach out and to educate folks on providing, trans-competent mental health care and healthcare in different settings, because we know that the need is so high. And if you're looking at, national surveys that have come out recently, I think that the Trevor Project, which is also a great resource for folks who are struggling, but the Trevor Project had a survey last year that looked at mental health needs of youth and found that half of LGBTQ youth wanted to have mental health care, but could not access it. And so that's a real problem, and something that we really need to focus on to be able to increase the number of providers that are out there that are versed in LGBTQ folks, to be able to provide really effective healthcare for them.
We just have a couple of minutes left. I just wanted to highlight again what Tony had mentioned through Healthcare Advocates International, I believe partnering with the Pediatric Gender Program at Yale for its first annual binder drive to support trans youth. Dr. Olezeski, tell us why this is important when you think about the patients you're seeing.
Yeah, it's very important. As I think Tony had mentioned, when folks are able to get these interventions, it's non-medical interventions, to be able to have a body that looks more congruent with their identity, it can be very helpful for them to be able to feel more comfortable going out in public, or just going through the day, being able to get out of bed. And so it's really important to be able to provide this resource for free. And one of the things that we oftentimes talk about with families is, I think that, as they may be waiting for any sort of medical interventions, or thinking about, maybe considering medical interventions if parents are not fully sort of accepting, is that there are these free interventions. Like I said, now having binders for free is great, but, also using some of these name and pronouns, and the data is out there actually for name and pronouns, that if we're using these interventions, that there's less likelihood of a youth engaging in suicidal behavior. So I think that we probably would see the same sort of data if we looked at the use of binders for youth as well.
And when you mention medical interventions, so binders can be used by gender nonconforming or trans youth to curb dysphoria without undergoing surgery, Dr. Olezeski?
That's correct, yes. So the binder is a garment that's placed on the top half of the body, and that compresses the chest area to look flat, like a more masculine chest, or non-binary chest, I should say.
We appreciate your time coming on to talk about the gender program. Again, Dr. Christy Olezeski, director and co-founder of the Yale Pediatric Gender Program within Yale New Haven Children's Hospital. Katy Tierney was also here, medical director of Middlesex Health Center for Gender Medicine and Wellness, and Tony Ferraiolo, again, director of the Youth and Families Program at Healthcare Advocates International. Thanks for your time today. And again, there are links on our website to learn more about these organizations at ctpublic.org/wherewelive. Today's show produced by Katie Pellico. Katie Tolarski was on the phones today. Our technical producer is Kat Pastor. Thanks for listening.